In December 1992, Ms. Triss, who was 57 years old, presented at Methodist Emergency Room with complaints of shortness of breath and chest pains. Ms. Triss had a history of smoking cigarettes for a decade and of obesity, and a family history of cardiovascular disease. Dr. James Davis, her family practitioner and attending physician, admitted her into the hospital. Her admitting diagnosis was atrial fibrillation. Given her history and the nature of her condition, Dr. Davis consulted a cardiologist, Dr. Fox. As a diagnostic tool, Mr. Fox recommended that Ms. Triss undergo a coronary angiogram. Ms. Triss signed a written consent form acknowledging that she had been informed of the risks of the procedure. Dr. Fox explained to her that these risks included a possible blood clot. On December 14, 1992, Dr. Fox successfully performed the procedure, which involved accessing Ms. Triss's femoral artery at the right groin in the body. Cath lab at about 9 a.m., Dr. Fox completed the procedure, dictated his report, left the hospital, and returned to his office. Pursuant to standard protocol, the nursing staff was instructed to follow Dr. Fox's typed list of routine post-catheterization orders. The first on that list, and the one pertinent to the instant case, requires the nursing staff to check vital signs and pedal pauses every 15 minutes to facilitate that routine protocol. A form labeled post-cardiac cath checklist was used. Indeed, Dr. Fox's first routine order is handwritten on top of the copy of that checklist from Ms. Triss's procedure that appears in the record. As ordered, the nursing staff regularly recorded Ms. Triss's blood pressure, heart rate, respiratory rate, and temperature on that form at the prescribed time intervals. What is not recorded on that checklist, however, is any entry under the column captioned pedal pulse palpable. Whether, despite the admitted failure to record that data, the nursing staff actually complied with the doctor's orders to check Ms. Triss's pulse is one of the dispositive issues in this case. At 9:20 a.m., while Ms. Triss was still recovering in the cath lab, she voiced her first complaint of severe pain in her right leg. At that time, the nurses could not manually palpate a pulse in her right foot, but were able to detect a Doppler pulse. The nurses notified Dr. Fox of the diminished pulses and complaints of severe right foot pain. In response, Dr. Fox gave her orders by telephone, which were recorded at 9:55 a.m. His new orders were as follows. 1. To administer increased dosages of pain medication, now and until as needed. 2. To check the foot every 15 minutes. And 3. To call him if there were any further problems. It is not disputed that Ms. Triss was administered pain medication at that time, and that she was not administered pain medication again that day until 3:10 p.m. What is disputed, and another of the dispositive issues in this case, is whether the nursing staff complied with Dr. Ferdinand's other two orders to do 15-minute foot checks and to call him regarding any problems. The medical record reflects that when Ms. Triss was given pain medication at 9:55 a.m., she again complained of pain and numbness in her right foot. At that time, the nurse notified Dr. Davis. Shortly thereafter, Dr. Davis saw Ms. Triss, apparently while she was still in the cath lab, and noted in the chart that she had returned from the angiogram at 9:50 a.m. complaining of right foot and right ankle pain that began after the angiogram. He further noted that he had informed Dr. Fox of his findings of a minor differential in the temperature of the right foot in comparison to the left. The right foot was cooler than the left, and that there was a slight pulse on the right side.